Correct. Yes. So I'm going to give the standard introduction, which is that Dr. Bradford Felker completed dual resident trainings in both psychiatry and internal medicine, leading to board certification in both fields. Much of his work has focused on clinical care, integrated care, program design and implementation, as well as curricular design. And then about 10 years ago, he changed his focus to digital mental health. He is a professor with the University of Washington, Department of Psychiatry and Behavioral Sciences, but he is clinically based and mostly based at the VA Puget Sound, where he works with veterans. He is also a proud Operation Iraqi Freedom Veteran himself and recently retired from the Navy Reserve. So we all like to thank you for your service, Brad, in that sense, but we also like to thank you for your service in this program and the work that you do. Having worked with Brad now for at least 5 years, I can tell you that he is not only an excellent psychiatrist, he helps me sometimes, but I know he has a great deal of respect and work with his patients. And he also is just such an expert in telehealth. He is too humble to say this, but he has really led the development of telemental health on a national level across the VA, and certainly within the University of Washington. That, boy, when COVID hit, we were doing some telehealth kind of clinic to clinic stuff, but having to shift into telehealth into the home, we couldn't have done it without Brad's help, because he had so much experience doing that and implementing it across different systems. So I want to acknowledge all of that and thank him for that. And then turn it over to him, because, as he said, he is really focused in on digital health these days, and he has become quite an expert. And I am looking forward to hearing what he has to say today. So I turn it back to you, Brad.
Thank you, Cara. And it is a complete delight and privilege to work with Cara and her team. We've had so much fun together over the years. Thank you for that very generous introduction. The check's in the mail, Cara. Don't worry, check's well. Anyway, let's start having some fun talking about the topic today. I find the digital divide just fascinating, and hopefully we're going to have some fun. Let's talk about our learning objectives. We're going to talk about the factors that contribute to the digital divide, who's at risk of being impacted by the digital divide. We're going to talk about digital navigation and how this whole new concept of digital navigation and digital navigators can potentially help close the digital divide. So there's a bunch of you out there. I'm not going to ask each of you this, but I would ask you to think about this question. So how do you define the digital divide? If we're sitting there having coffee right now and I talk to, hey, how do you define how do you define it? Because my experience with this is you ask a bunch of people how they define it, you get a bunch of different answers on the digital divide. It's just this fascinating topic that people, I think, are just starting to get their head around. So the first part of the talk, I would like to try and take some time to go over some definitions that I think are really useful to help you sort of get your head around this topic. And then we'll talk some more about it. So if you're interested in this topic, I would highly recommend that link I have. That group up there is doing some really fascinating work in the area of digital divide and digital inclusion. So we're going to use some of their work, because what I like about them is they're thinking beyond healthcare. They're thinking more about all aspects of an individual's health and life and how to be productive members of the community. So I typically don't like to read slides, but this is important. So I'm going to read this to you. The digital divide is the gap between those who have affordable access, skills, and let me hold on a second. I'm having trouble. Yep, there we go. Skills and support to effectively engage online and those who do not. As technology constantly evolves, the digital divide prevents equal participation and opportunity in all parts of life, disproportionately affecting people of color, indigenous people, households of low income, people with disabilities, and people in rural and older adults. So I really like this definition as a good place to go. But let's unpack this, because there's more to just this definition to understand all that's going on here. what I just shared with you is a big mouthful. So you need a working definition, and this is what I like. Basically, it's a growing disparity between those who have access to digital modalities, to include digital health, and those who do not. Now, here's some interesting numbers. Don't hold me to these numbers because this is a fast-moving topic right now, but the main points still hold. In the US, the FCC estimates that more than 21 million people lack the internet. More than 40% of schools lack broadband connection, and more than 60% of healthcare facilities outside metropolitan areas lack broadband connection. So don't hold me to those exact numbers. Fast-moving topic, but those main points still hold. This is a big problem. Let's talk about another definition, digital equity. It's a condition in which all individuals and communities have information, technology, and capacity needed for full participation in society, democracy, and economy. Once again, I like this group. They're thinking beyond healthcare. Necessary for civic and cultural participation, employment, lifelong learning, and access to essential services. So that's a nice way, I think, of getting your head around what does digital equity mean. Let's dive a little deeper here. Digital inclusion, right? This is a big topic these days. A lot of people are talking about digital inclusion. Basically, this group breaks it into 5 components. To have inclusion, you need to have access to affordable broadband internet. You need devices that can connect to that internet. You need digital literacy training. We'll talk more about that in a moment. You need quality tech support. We all know that. And then I really like the last point. I'll let you read it. We're all grown-ups here, but basically what they're saying is this is not a passive process. You just can't expect people to be included, particularly those at risk. You really need to have active programming and think about ways to go out there and continue to evolve and adapt and develop ways to include and bring people in. So you got to have the equipment, got to have some tech background, and you got to be thinking about actively engaging your community. All right, digital literacy. We're digging, as you guys have heard me talk before, I like to start broad and dive down deeper and deeper. Digital literacy, this is really important. So when you train digital literacy, what does that really mean? It means, how do you train so that people have possess a variety of skills, both technical and cognitive? And you got to be able to think and understand what you're doing. Required to find and evaluate and create digital information. He's able to use diverse technologies appropriately and effectively to retrieve information, but also be able to understand it, interpret it. Understand the relationship between light technology, lifelong learning, personal privacy. That's a big deal these days. If you've heard me give the talk on apps, we talk all about that end user license agreement, right? And stewardship. Use of skills and appropriate technology to communicate and collaborate with one another, and how to use these skills to get involved in a vibrant, informed way within your community. So when we talk about digital literacy, this is what we're talking about. Okay, so we've taken a moment to get spend some time on what I think are some foundational definitions. Otherwise, we don't really know what we're talking about with these terms. So you don't have to use these, but at least for the purposes of this talk today, I think it's important to sort of make sure we know what we're all talking about. Okay, so that's how you define the digital divide from a lot of different domains. Okay, now what do you think are the common causes of the digital divide? This is where I got really interested to do it, because every time I thought I understood it, yeah, not so much. So when I first started looking at this, I thought, oh, it's just old people. And not so much. A lot of grandparents are out there FaceTiming with their grandkids now. Okay, maybe it's just people living out in rural areas. Well, not so much. Distressed urban areas are really impacted. Okay, all right. It's different cultural groups, and yeah, that's true, but it doesn't apply to all ethnicities and cultural groups. money's probably involved in there somewhere. So anyway, I thought it was just fascinating. It's like peeling back these layers of an onion. So let's peel back the onion. What do you say? So to quote one of my favorite movies of all time, Casablanca, let's round up the usual suspects, because much of my career has been looking at ways to improve access to care, particularly in mental health domains, looking to barriers of care. And sadly, the same populations often struggle with access to care. And who are they? Educational level is really important. And that's been shown to really be one of the main predictors, and it can be directly impact one's income, occupation, wealth, age, and so that's really important to understand one's educational level. So as I go through these, I want you to be also doing your homework as you listen to this talk is be thinking about your clinic, be thinking about your clients, and be thinking about how this digital divide could be impacting them and preventing them from getting care. And we'll talk about that more at the end of the talk, but just that's your homework as you listen to me. Socioeconomic disparities, that's a huge problem. So for those people who make less than $30,000 a year, a lot of them don't have cell phones, don't have access to broadband, and don't even own a computer. However, if they make over $100,000 a year, they're likely to have all of those techniques and tools available to them. Rural versus urban. Like I said, this is very interesting. Actually, the gap in the rural areas is closing rapidly. I'm a little more concerned these days about distressed urban areas. You're not hearing much about that, but there are a lot of inner city areas lack these services as well. One study reported urban respondents 51% more likely to have internet access than rural. But like I said, this gap is closing quickly. The group that probably has the best access are suburban homes. And who are those people? The ones with the money, right? So once again, these things all tie together. They're sort of all networked together. But I think it's important to pull these factors apart so you can better understand them. Because if you better understand them, then you can do something about them. Racial differences. This is huge. In its different ethnicities are impacted in different ways. However, certain groups consistently come up at risk. African American, Hispanic, Native American communities. Less likely to use technology for health purposes, less likely to make or receive phone calls or access the internet for healthcare. So these are the groups that consistently come up in the digital divide. And if you are anyone like me who's done a lot of work in integration and program design, this is this tough group of people who really need our help to improve access to healthcare. Some more aspects on racial differences. Black and Hispanic, much less likely than white and Asian households to have access to internet. Black, Indigenous, people of color, BIPOC individuals, less access to technology and poorer skills for effective use, even after controlling for having the money. Interestingly, a high risk group, and it's not surprising once you think about it, is the older immigrants. Those individuals really have a lot of these risk factors all piled up on them. So we really need to be cognizant of these folks. The elderly, we talked about this, and they do remain a high risk group, particularly the widowers, particularly those living at home. This last point I thought was fascinating. As you get older, it's not linear in terms of lack of access or lack of use or the size of the digital divide. It's actually almost logarithmic, that the older you get, they rapidly drop off. And I'll let you read all those numbers, but so think about that as your population. If you have a clientele that's getting older and older, they're going to be significantly at risk for being left behind. And you got to, as a good healthcare provider, you got to be mindful of that. This is really cool. This is really, you're gonna dig this, at least I did. A disability status is really a big deal. All right, that kind of makes sense. Those people who have different disabilities have difficulty accessing the internet. However, as you read down below, once again, I can't stand it when people read slides. You're grown-ups, and I'm sure these slides will be made available to you. Interestingly, if you provide those people with disabilities with proper accommodations, they use the internet just as well as those without disabilities. So once again, that's a really interesting thing to think about. Think about your clients, think about your populations. Or if you're able to get them those accommodations, able to get them that digital literacy training, could you really help them out? Okay, so if I just stop the talk here, you'd say, gee, Brad, that's a really depressing talk. Right? You'd say, guy, all these people are out there, they're being left behind, and they've got all these problems and all these challenges. It is a big problem. It is a big problem. But there's good news. Good news. There is now some really interesting work being done in this area of digital navigation to include digital navigators. So there is a way, there is a path forward that's developing an evidence base. All right, so it's just not me, just Brad saying you should do this. There's a developing an evidence base out there now for how to start to close that digital divide. So let's take some time and talk about that. Okay, digital navigation, it's emerging. Okay, it's this emerging concept, and it's really inclusive of really taking a hard look at your clients and the challenges they have, but also taking a hard look at your clinic. Okay, one of the problems that's always bugged me about doing integration work and working to improve access is, let's say, how do I say this without being rude? Let's say that us healthcare providers can be a bit arrogant, right? It's always the patient's problem. We always want to look to them as the ones who challenge. We don't look in the mirror very often, and I think we should. And so as we think about digital navigation, yes, we need to look at the challenges our clients and patients have, I just went over, but it's incumbent upon us to say, what are we doing to contribute to this digital divide, right? I mean, if it was just the patients, it'd be kind of more of a digital cliff, right? So I want you to kind of think digital navigation is a concept that talks about, you really need to think about, what do you need to do at your clinic level to embrace and implement and integrate digital modalities and technologies? What changes do you have to make? We'll talk more about that. That's a whole talk on itself. If you want me to come back, talk about that, happy to do that. But let's just focus down on one core, because of time restraints. Let's just focus down on just one core component, the digital navigator. Right? We'll talk more about this in the middle, but I like to think of this digital navigator as that individual who's going to form that handshake and connect your clients with your clinic. Okay. There's some lots of different, we'll talk more about this in detail. Emerging evidence is starting to show that, particularly for behavioral health, that digital navigation has been successful in improving a user's confidence, both patients and providers, and to help close that digital divide, particularly for mental disorders. Digital navigation has been used to help mental health providers better care for their patients, leading to improved digital literacy. We talked about that. Better improve outpatient care, and better support helping patients take that next step to get care over the internet. So if you don't believe me, here's some references for you. Digital navigators. Okay, let's dive down more and talk about that in more detail. Who are these people? Digital navigators are trusted guides who assist community members in internet adoption and use of commuting devices, right? Digital navigation services include ongoing assistance with affordable internet access, device acquisition, technical skills, and application support. So it's a big job, but it can do it. And you can start to see how, see why I think this individual is going to be at the core. It's going to be at the hub of connecting your clinic to your clients. It is at the core and the hub of a successful clinic-wide digital navigation program. Okay, let's talk some more about digital navigation in the Alliance. And let's talk about this digital navigator. So, okay, so maybe you're starting to think, okay, Brad, I'm digging what you're saying. Maybe we should get one of these digital navigators. Who do we get? Well, once again, there's my favorite group out there, and they've done some careful thinking about this. So what type of skills would this digital navigator need to have? That's a good place to start. They need the ability to embrace the challenge of learning and teaching basic technology concepts related to the internet and computer and device acquisition. They need good organization, relevant language capacity, and good cultural competency. Think about all those risk factors, right? You're going to need an individual who's got some sensitivity around those things. They have to have really good communication skills in a lot of different forums, and including the ability to earn trust with clients and cultural backgrounds, right? They really need to be somebody people can feel like they can relate to and trust. The ability to demonstrate excellent interpersonal skills, cultural sensitivity, a good sense of humor. As you guys know, anyone who's worked with me, that's pretty much what I'm at the top of the list after 30 years of doing this work. In working with a diverse set of clients, coworkers, and community. What else? They need to be able to solve problems, negotiate, and handle stressful situations. You can keep reading. Good customer support and ability to speak, particularly if you're working with working in a clinic with people from different backgrounds, cultures. They want to, be able to speak at the native language. And we talk more about a project we're doing later in this. So you're starting to sense, okay, so this is what these people, sort of their backgrounds have. That makes sense. I can think about that. But what do they need to actually do? What do they need to actually train them to do? Well, here's a good starting point. Okay, so you found this person and you're ready to go with them. They're ready to go and you're excited. So, all right, what are you going to train them in? Well, how to initiate discussions and offer the clinical assistance. Talk, have a good understanding of what internet services are available in their area and how to access it. And what type of devices are they going to be using? What type of devices are available through their clinic, right? How to understand where the clients are with access, connectivity needs, and what do they need to be trained on? What low-cost services are available, right? And help them. How do they go about helping them get all of that stuff? Coach, and then providing them with coaching and ability to do all of that. So this is all focused on the client. I would add to this list also the ability to work with a diverse set of providers and admin in a clinic, right? If they're only working, once again, that's the healthcare system looking in the mirror, because they've got to also be able to work with the providers, frontline staff who are critically important to the success of any clinic, as we know, in admin leadership. So think of them as that hub, that person who holds it all together. All right, so let's take a pause here. Hopefully I'm not going through this too quick. Want to leave plenty of time for questions and concerns, and Kara's got some outro slides for us. So let's just pause and review for a second. So we've talked about what is the digital divide. I've tried to give you guys some useful definitions to think globally, but then also think about the foundational pieces that help inform a better understanding of what the digital divide is. We've talked about who's at risk and what are sort of the factors that are currently contributing to the digital divide. Who are the people at risk? Who are your clients at risk? And I've encouraged you to start thinking about your clinic, right? And we'll talk about more of that in just a moment. Okay. And then we introduce this and that would be a terrible place to leave you. So then we've introduced this new concept of digital navigation, which really embraces more, the clinic and your client and your patient population in your community. But because that's a ginormous topic to cover, we just covered one core piece of it today, the digital navigator and what their role is, and thinking of them as the hub to all of this. Okay, so hopefully you're with me at this point. So now I want you to think about your clinic. Think about what could you do right away, even if it's just little steps to start to help close that digital divide in with the patients you work with. So take a look around your clinic. Think about the clients you serve. Let's look at some practical tips of what you might be able to do. And think about if it would make sense to start embracing a digital navigation system. So the first thing to do is, who are you taking care of? And think about your panel. Think about the schedule of patients you have today. Think about who might be at risk, but they feel maybe a little too insecure or nervous to talk about this. I know you're all crazy busy, but does it warrant maybe asking a few questions about this? What about their age? We know that's risk, their culture, their educational level, probably the most important thing. What kind of disabilities if you were able to help them get some accommodations, would that help? Right? May not be able to help them with income, but it's something important. And then if you got them some digital literacy training, would that make a big difference? Right? Okay, start thinking about your clinic then. Okay, well, I showed you the data earlier. A lot of clinics lack access. Do you have access to broadband? What's the equipment like in your clinic? Does it need to be upgraded? Right? Do you have space available for? I've been implementing programs in clinics for many, many years, and as I like to say, space is a blood sport. I know it's always valuable, but do you have a room that maybe you could set up to help people connect? Do you have HIPAA compliant software? At the beginning of COVID, there was all kinds of waivers. Not so much anymore. You got to be using HIPAA compliant software. The last thing you need are the feds knocking at your door, trust me. Okay. What about your provider tech literacy? There's a lot to cover there. The good news is we've covered a lot of if you're new to this service, look back to 101, 201. Carr is going to go over that with you. We've covered a lot of these topics already if you want to go back and get some training in these areas. Is your clinic ready to embrace these this work and take this task on? Do you have the admin leadership? Do you have the funding? Do you have the IT support? Right? It needs to be more than, gee, Dr. Felker, have you restarted your computer? You need some more IT support than that. As we talked about space, it's a blood sport. Does it make sense for your clinic culturally? Do you have access to the accommodations? Workflow is really key to have an efficient process to this. Are you willing to sit back and really be creative about workflow within your clinic? And what about outreach into the community? Are you ready to start really connecting with your community in a variety of ways to start thinking about closing this digital divide? And then once you've done all that, would a digital navigator help? Could that individual really help close this gap? The studies I'm waiting for that I think I can predict are pretty much what they're going to show is when you start seeing some financial or economic research being done to this, because everything's going to come down to return on investment or ROI. And I'd be willing, I haven't seen the data yet, and if people know studies out there, I'd love to see them. But I would be willing to bet that investing in a digital navigator will show a positive return on investment, that this individual is going to save you money, decrease no-shows, improved access, better clinical outcomes. Think about all those performance metrics your admin and leadership is always really working to improve your clinic on. I would bet Kara's money on that topic, that we could improve the ROI. But if you had the ability to hire somebody, what would this person look like in your clinic? Got anybody who fits those skill sets that we talked about earlier, who would really be that ideal person? Could you train them? Could you get them in place? Could you get them going? I don't know. That's what I'm asking you. But hopefully what we've been able to do is break this down into things that you can take, giving you that basic definition of what digital divide is and the core foundational elements of it, showing you the people at risk and how important it is, introducing digital navigation and that broad term, but hopefully here showing you some specific tips and things you can just look around your clinic, maybe just make a little small change here and there. You might be surprised at what a big impact that could have. So if you are interested in learning more, I know we have people from all over the country today, but at least in the state of Washington, there's a lot of links and resources that are coming on and growing really fast. I would encourage you to take a look at. If you're from another state, there's so much federal national money pouring in the states right now. I would once again bet lots of cars money that your state has access to and have startups and links just like this for you to access. Just going to briefly touch base on this. I feel so privileged and thankful to be part of a team that we're actually doing an implementation study here in state of Washington with the Community Health Network of Washington, the CHNW. And we're working with 12 different clinics to implement a digital navigation and digital navigator program. We're going to look to expand the link to care in Washington. We're going to hopefully build capacity with the community health centers to provide digital navigation. We're going to identify and build community partnerships to support sustainability and Wi-Fi and develop recommendations for digital navigation. So this is an exciting project. And what's important to me is, and others I would say too, is that we're really being careful about this. We're looking to the literature and the implementation science methodologies to guide this project. If you've ever done any implementation work, I think you might agree with me. Everything looks good on a whiteboard, right? Everything looks good on a whiteboard. Getting it operational in the field is tough, really tough. So we're going to be looking at using Paris criteria, re-aim, and implementation facilitation. If you don't know what I'm talking about, I'm happy to expand on those, but those are well-proven, evidence-based approaches to implementing a program in the community. So there's another link there. So hopefully maybe I can come back, or Cara and I can come back and present on this work later if you guys are interested in it. We're excited about it. We're just getting going with this project, and so far so good. So in summary, the digital divide is complicated. It's multifactorial, likely still not totally understood, and represents a significant barrier to care, significant. But digital navigation and digital navigators is a system that's developing an evidence base that should be proven to work. It seems practical and doable. It seems likely, but more work's going to need to be done. The good news is that there's a lot of federal and national and state level money pouring into this system. And so hopefully if this is something you're wanting to pursue, you can find the resource and support. So like I said, want to leave plenty of time for questions and thoughts, questions. This is the picture I wanted to use to introduce myself because there may have been pirate themes involved, but Cara said, no, Brad, I don't trust you. I'm going to introduce you. So anyway, think about thoughts and questions, of course, that you guys know me. I appreciate a good joke. Cara will do some outro slides and hopefully we'll have time for some questions.
Yeah, actually, we do have questions. Let me read off one comment, though, that came into the chat first from Kimberly, a couple of them actually. It says, if it was allowed, I would have clients use FaceTime or text so they can easily access services, tools that they're really familiar with. A lot of other programs are clunky, have no creativity, and layered to connect or reconnect, particularly teens and geriatrics. And then she says the other challenge is the robustness of the programs that make it a challenge, particularly in my rural area. Systems get bogged down way too easily. So I
Could
think
not
that
agree more.
yeah, it's a challenge. And unfortunately, FaceTime is not HIPAA compliant. So we're not allowed to use that. And texting, I think people are starting to use text, but in a way that kind of gets around the HIPAA compliance issue, that if the patient texts into you, that's okay, but you can't, as a provider, text out to them with any
Yeah, you have to
page.
go through a lot of different security.
Yeah.
It's not ready for prime time, though I do know some healthcare organizations are using it routinely now, but I haven't seen that it's ready for prime time yet.
Right, exactly. Okay, so question, can the CMS recently published rule, which was January 2024, requiring MA health plans to screen patients for digital literacy help or accelerate digital equity?
Gosh, I don't know. Cara, do you know the answer to that one?
Well, I don't know the details of that rule, but I would think that yes, that's I think that the feds are and CMS are starting to recognize or have already recognized, but are starting to try to do something about digital literacy and recognizing that it really is creating a lack of equity, I guess. So yeah, we hope that will be helpful and will be folded into, everybody's screening of patients so that they're aware of, especially if you are offering virtual and remote services, that they'll be able to track those patients and be able to better, pull them in if you're able to provide digital navigation services or support. Good question. Let's see. Someone wrote, is that for big organizations or any organization can use this plan? And I'm not sure
I'm not
exactly.
sure which slide that's referencing, but if that's digital navigation, I would think it would be operational for any size plan. If that's
Yeah. Elham, you were the person who submitted that question. Maybe you could expand on what you were trying to ask about. Let's see. Comment again from Kimberly. She was a classroom teacher for a decade. I wish I could afford a smart board at work as a clinician. It would be so engaging. So, let's see. Yeah, lots of thank yous and appreciation.
Yay.
Is what I'm seeing. Yeah.
I'm glad I was able to help you there, Helma.
Yeah. Right. Yeah. I think those are the only questions that we have.
Okay. Well, I'm hoping, once again, the focus of these presentations are very practical. They're not supposed to be grand rounds. So hopefully we were able to convey some information that's new and useful and practical for you today to start thinking about that you can use at your level.
Yeah. Looks like something else might have come in. Hold on. In your digital navigation project, are you planning on providing services to all patients or only those who are looking to leverage telehealth technologies?
I think it's for the entire clinic. It's for the entire clinic because we want to implement a whole system change within a clinic to include, gosh, where do we start, Carl? So with this process, we started by developing a questionnaire for the clinic that goes over a bunch of quantitative data that describes sort of all those risk factors that I covered. Then we followed up the quantitative survey and with focus groups so that we can really start to understand how the care is being delivered and really start to develop those trusting working relationships with the clinic and start to tailor that. So the goal is to really impact, help implement a program that is impactful and changes the culture of the clinic for everybody, providers, admin staff, frontline staff, clients, the community, outreach, and so forth. Am I missing anything, Cara?
No, I was just going to say that, you and I have been involved in telehealth for 30 years or so. And we've been not televangelists, but telehealth evangelists, trying to spread the word. And, when COVID hit, suddenly we saw that although telehealth can certainly help with access to healthcare for patients who are in rural and frontier communities and underserved areas, that telehealth itself had its own access issues, which is the digital divide. And as we all can see, healthcare is becoming more digitized. And so it's not only using digital navigators to help get patients set up for a telehealth appointment, but also maybe to teach them how to use an app that you might use, in conjunction with your practice, or to help them connect to the patient portal and the MyChart and be able to communicate with the provider or schedule an appointment or see their labs or things like that. With AI and, it's just, and behavioral health is sort of leading the way in terms of utilizing these new technologies to integrate into care. And we just feel like if certain patient populations are unable to tap into this, they're just going to be left behind, not only in healthcare, but gosh, everything, you
Well,
go
then
out for
that's why I
dinner.
like that digital inclusive
Yeah,
organization. They're really asking you to think beyond healthcare.
right.
Marjorie, I see a comment coming up. Sorry, this was not on AI today. We had speaker scheduling challenges. We have a talk of that coming up. Thank you, Topher, for doing a better job answering that. I guess I could say that I'm an AI bot, couldn't I, Cara?
You could pretend. Yeah.
Other thoughts? I mean, there's things flying by here really quick. Seems that, I think it said Elham said you actually do some digital navigation work as a digital, that's way cool. Maybe we should have you come speak next time.
Yeah. Also to be aware that there are community resources for digital training, digital literacy training. Sometimes a lot of libraries are involved in this, and other community-based resources. It's opening the door to learning how to use the healthcare related technology. So you might still need a little bit of help with that, but utilizing those community resources can be really helpful. But yeah, those digital, I don't know, Brad, how many times as a psychiatrist had you had to spend, 20 minutes getting your patient connected? And that's not a good use of your time. And it's
daily.
Yeah.
It's really frustrating. And the comment made earlier about multiple clunky devices is, my sincere hope is that we're in this bizarre little window of time, and if could do some time travel, could, look back at this time as, you're driving, you ride a horse and you're driving one of these new buggies, and, and where is this all going? And, that my hope is that, being the eternal optimist, as people know me, the glass isn't half full, it's brimming over, is that we're in this really rocky, bumpy period of time, and that we should hopefully in the next few years, my hope, really start having devices that are much more user-friendly, much more consistent, much more standard of care.
Yeah.
But to get there, we've got to do this hard, heavy lifting right now.
Yeah. Right. I feel like that's a positive note to end on. So
Well,
we'll
if you
wrap
have
up.
questions, thoughts, concerns, good jokes, I left you my email. Feel free to reach out to me. And thanks again for coming today. It's always fun to speak at this group. It's just like I said, it's a fun community of practice we're building.
Indeed it is. Thanks so much, everybody, for joining us today. We look forward to seeing you next month. And in the meantime, wish you a lovely weekend. I always like to say that because we're on a Friday, early afternoon. So have a lovely weekend, and we will see you next month.